Good afternoon, everybody. I am Dr. Bimal Prasad, working as a neurologist in Care Hospital, Nampally. I am a neurologist, so I deal mainly with the brain and like stroke, seizures like fits, neuropathy, and other neurological disorders. So we'll discuss today two topics, that is stroke and epilepsy, which are more rampant. Stroke, as you know, is more seen nowadays in young populations, mostly because of our lifestyle change, like high blood pressure, high diabetes. Our food habits are changed. We are more towards the processed food, not like the organic food what we were consuming or what our elders were consuming, and lack of exercise and more of stress factors. So once the patient gets a stroke, the importance is to identify the stroke as early as possible. That is called the window period or the golden hours. During that time, if we can give some medications, we call IV thrombolysis, then we can reduce the damage of the brain cells, that is called the neurons, and we can actually help the patient in recovery fast. Some patients cannot be suitable candidate for IV thrombolysis. In that cases, we advise them to go for intra-arterial mechanical thrombolysis, and that is also possible in our Care Hospital, Nampally. Second is how to treat the patient. These patients are being treated lifelong with modification of the blood pressure, means regular taking medication like blood pressure, sugar, lifestyle modifications, and food habit modifications. Some patients have notion that after taking sometimes the medication, you can stop the medication completely. This is not like that thing. We have to regular in touch with the patient, with the doctor, treating physician, and physiotherapy, walking, exercises, yoga, pranayam is more important. So also reduction of the salt, oil, sugar, sweets, and red meat is important. Patients has to counsel regarding the lifestyle modification and medication use for most of the time. Second is our epilepsy, we called as seizures. Seizures can occur from childhood to adult. Anytime it can occur, and it can have, for some days it have multiple episodes, some day there may not be any seizures. So main aim of treatment is reduction of the frequency of the seizure. Otherwise the patient may lose their job, lose their social status. So the main thing is treatment of the adequate treatment with adequate doses, adequate timing, that is more important, and some behavioral changes like proper sleep, reduction of the sleep time, and avoidance of the stress factor, that is more important nowadays. Some people think that after taking for some time the medication, if the patient is seizure free, we can stop completely. That may not be true in all cases. Some seizure patient can stop the medication completely, but most of them require medication for a longer period of time. That means can have for few years also, maybe 5 to 7 years. During that time, you should not stop the medication without any advice from the treating doctor, and regular medication is important. That's all. Thank you.